but she should be at a very, very low risk for having Moya-Moya disease. So this person be at a high risk. Yes?
Yeah, I didn't have my first stroke until I was like 47. I wasn't diagnosed until I was a year and a half later.
Yeah.
Does that mean that I have the gene, but it just didn't come out in me yet? Or
yes, exactly. And some of that, I think, is once again those environmental effects on your arteries. Now, we don't understand. I use smoking and high blood pressure as examples, but we don't know.
Pressure, but my husband was a
smoker, so you may have gotten some secondary.
That's it caused it to come out into me.
Right. So she's asking the question, you know, why does in some people when you have this gene alteration, it shows up younger than others? And I'm just saying that it's some of those environmental factors that probably dictate the age of onset. Yes.
Okay, my son is 7. He was diagnosed at 2, had the surgery at 3, but he only has it on the one side. Is there enough determination yet to say whether or not he'll get it on the other?
No, we don't have that data. And that may vary based on what gene is altered and what alteration there is in that gene.
I know they were researching it back when he was 3. I just didn't know if there was any new data that would say whether or not he would get it on the other side.
Yeah, but I would say that he needs to be watched for disease on the other side. Yes?
Her youngest grandchild is less than a year old. Should he be tested?
So right now, I'll talk about that in just a minute. Who should be tested for variants in this gene? Yeah.
I guess it's probably the same answer question. Have you come up with some sort of a checklist or protocol for deciding who should be tested and who shouldn't be tested?
Let me talk about that in a minute. Any other questions? Yeah.
Forgive me if you already said this, but is it possible to have the disease without having the variants?
Yes. Okay, so this is, like I said, if you go back a couple slides, only 10% of our Moya-Moya disease patients in our study had variants in the gene, and many of those were the Asian patients, okay? So if we look at the number of people that are not Asian or European descent primarily, that as far as variants, the number that had variants was much lower. So once again, it comes back to the fact that there's probably many genes that can be altered, not just this gene, that increase the risk for Moya-Moya disease. So if for the people in this room, if you're not Asian, you know, it's probably less than 5% will have variants in this gene. Okay, so who should be, so so go back. So what we're recommending, go back one, is that if you're of Asian descent, you should be tested for this particular Asian variant. So those are people from Japan, China, Korea, any of those Asian countries, and on into India. And so because we do pick up variants in this gene. Now, the caveat is that there's no diagnostic labs that have picked up testing for this variant yet. So based on the fact that we can find this variant in U.S. populations, we're working with diagnostic labs for them to set up and test for this variant, okay? And at this point, I think you can use this if you're of Asian descent and you want to test other family members to see their risk, like your children or your sisters or brothers or whatever, that if you find this variant in yourself and you have Moya-Moya disease, or this variant in your child with Moya-Moya disease, then other family members should be tested. What we don't know is, we know that they're at increased risk for Moya-Moya disease. Are they at increased risk for other vascular diseases? We do not know that yet. And probably since, you know, in Japan they have many more families and many more people affected, we'll really turn to Japan and the researchers there for the answers to that question. So if you're not of Asian descent, we still need to work some more to figure out how common variants in this gene are. It's a huge gene and we haven't even sequenced the whole gene. So it may be that variants are much more common than we think right now. But it's very expensive to do these studies, and we're looking for somebody to fund us to go through and systematically sequence this gene so that we can determine how common changes are, and do all those changes cause Moya-Moya disease. So we're still working at this. Okay, so right now, I don't think you should be, that if you're of European descent, that you should not be sequenced for this particular gene yet. Yes?
Well, I'm Filipino, so that kind of puts me in the Asian category. So does, how does my family test for it?
Okay, so she asked is because she's Filipino, and that puts her in the Asian category, how does she get tested for that? Like I said, we're working with diagnostic labs so that you can go to your neurologist or to a geneticist and get testing. In the meantime, we're happy to do the testing as part of our research study. Because once again, it provides us information to begin to understand. So even if they find other vascular diseases in Japan that are associated with this changes in this gene, we need to confirm that in the U.S. because it is a slightly different, environment.
My uncle actually had it too, but he only had, his was only affected on one side. So
Yeah. So, yes, so we'd be happy to test you as part of our research study. Yes, in the back?
So do you know if there's any correlation between hardening of arteries and this?
So we think that this gene causes moyamoya disease due to the fact that it causes those cells in the wall of the artery to grow too much and grow into the lumen and occlude it that way. We have no data yet to support that hypothesis. Okay, and I'll talk more about what data we have to support the fact that other genes do cause that. In the back?
If you were tested and you don't have the gene, are you still at higher risk for?
I'm sorry, I can't hear what you're saying. Sorry.
If you were tested and you don't have the gene, are you still at higher risk for vascular disease?
We don't know that question, but I'll talk more about that in just a minute. Yes?
If you were tested in San Antonio, are you able to tell us if we had the gene?
Okay, so so my lab is a research lab, and it's not a diagnostic lab. Diagnostic labs need to be certified and all that, and it costs a lot of money to do that, and we'd rather take the funds we have and do this type of research. And so right now, if you gave a sample in San Antonio, we have most likely sequenced part of this gene in your sample. And so our human subjects research board that kind of watches what we do and makes sure that we do things in an ethical and correct, manner. They have allowed us to call back families that have variants so that we could test other family members to see if it's causing moyamoya disease or other vascular diseases to run in the family. And so if you haven't heard from us, then chances are you don't have a variant in this gene. But once again, we haven't sequenced out a gene. The gene is huge. It's really huge. And so for us to sequence it, one individual costs over $5,000 through the whole gene. So we've only sequenced limited regions in a large number of patients, moyamoya disease patients. Yes?
What is your number of patients that you tested?
The number of patients tested? Typically when we're doing these types of screening, we sequence 100 patients from the cohort.
10 patients out of 100.
I'm sorry, I can't hear
Only
what you
10
said.
patients then had variants.
So 10% of them had variants. And like I said, the major variant was in the Asian patients in that part. And I'll take more about the patients. Yes?
I want to ask about the carotid artery, because I'm like 70% blocked in my left carotid artery, and I'm going to have another test done. They're testing me every 6 months because I'm 70%. Does that, a lot of moyamoya people have the carotid artery?
I'll talk more about that in just
Oh,
a
okay.
minute.
I just wanted to ask
Okay.
about that.
So next slide. Okay. So this is a gene for moyamoya disease, and in the next slide I'm going to talk about another gene we found, and this is what got me interested in moyamoya disease. In this case, the gene is called ACTA2, and we call it ACTA2, and we were studying patients with thoracic aortic aneurysms, and those predispose people to aortic dissection, where the aorta gets ripped apart and it can cause sudden death. So we want to identify who's at risk so we can repair the aorta before the dissection occurs and prevents death. So in patients, we identified this gene, ACTA2, as a cause of the aortic disease in families. But some of the patients' families had variants or changes in the gene that caused moyamoya disease. So here's 3 different families. Everybody in black had aortic disease, and then everybody in green has moyamoya disease. And you can see right away that there's some people that have both disease, a number of people that have both diseases in this family, but there's a number of people that just have moyamoya disease. So this is what got me interested in moyamoya disease. This gene predisposes to both the aortic disease, which is actually an enlargement of the artery, not a narrowing of the artery. It causes moyamoya disease, which is a narrowing of the artery. And if you go to the next slide, we have families like this one, where it's also causing that problems with the arteries in the heart and heart attacks, and what we call coronary artery disease. So here's changes in one gene that cause, where we know now, it causes aortic aneurysms, causes moyamoya disease, causes early onset strokes that aren't moyamoya disease, and causes early onset coronary artery disease and early onset heart attacks, okay? So this is why, what got me interested in moyamoya disease, because I think it may tell us a lot about what causes vascular diseases beyond moyamoya disease, and tell us a lot about what is going wrong with the arteries that's causing the coronary artery disease and the aneurysms. And we're trying to figure out why, when you alter just one base pair out of 3 billion in the genome, and when it falls in this gene, that you can have all these different types of vascular diseases run in families. Okay, so next slide. So when I started this study about, 3-4 years ago, when was San Antonio?
2007, I think.
7? Wow, so it's been a while.
Yeah.
We started recruiting patients. We're about 120 patients with moyamoya disease. We collect a lot of information as part of our study. You get a lot about the disease, what age of onset, the symptoms, and so on. What kind of environmental risk did they have? Is smoking, alcohol, and so on? Obviously, this doesn't apply to children. We get the medical history. Was there any genetic or chromosomal changes, other birth defects, other problems? And then we get the family history. Okay. So, go ahead, hit the slide again. So in our first 100 patients that came in, you can see most of them are Caucasian or of European descent. We only had about 10% of our cohort that was actually of Asian descent. Because we're in Houston, we do get Hispanic patients, and then we get some African American patients. By far, mostly we're recruiting into our study are people of European descent. And I don't know if it's because in the U.S. it's primarily in patients of European descent. Certainly there's many more Caucasians than there are Japanese, people of Japanese descent in the U.S. But, or if we have a recruitment bias, because by and large, we posted on the website and we tell physicians that we're interested in recruiting patients. And so it's based on people coming to us to be in the study. And then we recruit some from Houston that can show up in the hospital. This was the age of onset, the number of patients and the age of onset. So we have most of the patients presented between 1 and 10 years of age, and then there's another peak about 30 to 40. And this is already known. This is pretty typical of moyamoya disease. We found in our study, we found people with Down syndrome and people with other changes in their chromosomes, but that was pretty rare. And about 10% of families, it ran in families, okay? And that's also typical. Okay, so one question we asked is just, do patients with moyamoya disease have other vascular diseases also? And we found that they did, and this is just a list of the other vascular diseases. And I bring this up because I think that you need to, if you have moyamoya disease, you need to talk to your physician about, making sure that other arteries in your brain are also checked very carefully. Most of what we saw were some problems with the renal arteries in addition to the moyamoya disease. And so, but at this point, we're not sure how much screening for other arterial diseases people should go through. Many of these will show up with symptoms, and they can be diagnosed and be treated. And so for renal artery stenosis, if it's significant, the individual is going to have high blood pressure. So certainly, even in your children with Moyamoya disease, make sure their blood pressure is always checked when they go to the doctor. Many of the other ones, like vertebral artery occlusion, carotid artery stenosis, which I think you mentioned you had, can be picked up with the imaging of the carotid arteries that they do pretty routinely after the diagnosis is made. The problems with the aorta, you will have the child or the adult will have symptoms that raises that possibility. Once again, people with this vascular disease called aortic coarctation have high blood pressure. So make sure they look at the other arteries when they image the brain, and that you get checked routinely for high blood pressure. Okay, so then we asked the question, was there other vascular diseases in families? And so here's our patient with Moyamoya disease. Her mother had Moyamoya disease. Her mother was actually having symptoms, so we had her imaged, and it turned out she had Moyamoya disease. And then she had two brothers that had a sister and a brother that had a heart attack at very young ages, that didn't smoke and didn't have high cholesterol. And then dad, their father, had a heart attack. So could this be due to one change in the gene being passed down through the family that's causing these various vascular diseases to run in the family? Possibly. Until we find the gene, we can't prove that. But it looks it's very suggestive that there's something running in this family that's causing multiple different vascular diseases. Here's another example. This woman with Moyamoya disease had renal artery stenosis, and she also had an intracranial aneurysm. So she had other vascular diseases. Her mother has migraines, and I think we recommended screening, but she hasn't been screened yet. She had a sister that had a problem with her arteries in her brain, and as did the mother and the grandmother. So once again, there's three generations of women having other problems with the arteries in the brain, and these were intracranial aneurysms or cerebral hemorrhages. And then suddenly this woman shows up over here with Moyamoya disease. Is it the same gene causing all these vascular disease? Once again, we won't know until we find the gene causing the disease. But I'm suspicious that is the case. So we're very interested in finding families like this and the previous one, because suddenly it gives us, if we have multiple members with cerebral vascular disease or other vascular problems, it gives us a lot more power to find the genes. And like I said, I think we're looking for a lot of different genes. And it may vary from, this family here and that family over here sitting in the room, okay? So when we looked on the mother's side, so what we did, we asked the question, do first and second degree relatives have vascular disease? We looked at early onset strokes and coronary artery disease, other arteries that were stenosed or had aneurysms or dissections. And so on the mother's side, we found that about 45% of her patients had disease, and on the father's side, about 40%. So whether we looked at mom's side or dad's side, there was often some vascular disease. Now the question is, if we just ask people in the general population, how often do they have vascular disease? It's actually very low, but to publish this data, we have to put a number on it. So now we have somebody sitting in pediatric clinic and adult general medicine clinic and getting controlled family history. So we should publish this data probably within the next year. Okay. So in summary of what we know about the genetics, because now I'm going to switch and talk briefly about what we're focusing our treatment studies on. Moyamoya disease can run in families, we all know that. Some Moyamoya patients and family members have other arterial diseases at young ages, and that makes us think that Moyamoya disease may be a marker of a vascular disease gene running in the families. We know that ACT2 mutations cause Moyamoya disease and all these other types of vascular diseases. And so right now we screen our patients with mutations in this gene for Moyamoya disease so we can prevent those strokes. And so in some of those families I showed you, the Moyamoya disease was picked up in other family members after we found the ACT2 mutation. And they've gone to surgery, and once again, pretty uniformly people say, I can think better after the surgery. And I think that's due to they chronically have low blood flow and